Welcome, Fundis, to another segment of Funda Chat. This is part of our Cerebral Palsy Rehabilitation series, and today we're talking to Kerry Millar, who's a physiotherapist. Thank you, Kerry, for joining us, and thank you for giving us the time to go through your thoughts on this process and enlightening us on, the physiotherapist's perspective of treating cerebral palsy and neurologically struggling kids.
Oh, it's a pleasure. Thank you for having me. It's quite an honor to be here and to be able to just try and put the word out a bit more and educate as much as we can.
Perfect, thank you. So, Kerry, tell us a little bit about what it entails from your perspective on your involvement in the CP treatment, and if there's anything you'd like to highlight, that you've experienced from the treatment.
So, as a physio, we play quite a big role in the management of the child, together with the other therapists, occupational therapists, the speech therapists, the doctors. It really is a whole collaborative affair to look after these children. We deal with variety of complexities within the kids, and it has to be a very much a team approach in order for us to get the best from the child. From a physio perspective, we work in quite a lot with the big muscles within the body, trying to get the child as active as possible. If the child is able to do something, we try to work on getting them to work better with their bodies. Cerebral palsy is a condition that affects the brain, so the brain is damaged. There's parts of the brain, and it varies from child to child where exactly the damage is. But from a physio point of view, we really try to have a look at the child, what they can do, how they are doing it, and then we try to teach them ways in which they can do it in a more efficient manner, by trying to reroute the pathways where there might be damage and where the movement is affected. So in general, we work on the movement. We work on trying to get better movement from the child, more efficient movement, which then translates into better function, really.
Okay, so because obviously, if you through repetition, you're repairing the pathways,
Yes,
or creating new ones.
definitely.
So doesn't matter the age of the child or the state. Obviously, the progress isn't the same. If you're getting a child at 4 years old and you're getting one at, already a teenager, there's a big deficit for that older child specifically, because so many muscles have already
Yeah,
developed. But so in your process, obviously repetition is key.
definitely. So, like any child, even if it were a normal developing child, a child learns through, and we all as adults as well, we learn through repetition and different ways of repeating things. So, if you had to look at a normal developing child, they do a certain activity. They stand up on the floor, then they go and they stand on the bricks, then they go and stand on the grass, and all those different sensations that they're getting through their body tells them different things, and they're constantly moving. With our children with cerebral palsy, they often don't have the experience of movement themselves, so we try to give them the different experiences so that they can then learn through various ways. We also try to give them the experience of sometimes not getting it right, so that their brain can also learn that there is a right and a wrong way. And there has been quite a lot of shift in that thinking of not always teaching them perfectly
Mm.
every time, but allowing them to feel and do different things in a different manner, so that they are able to experience the right way and able to experience the one that might not be as efficient. Um, so that is what we try to do through the repetition. So basically, we're doing repetition without repetition, if that makes sense. So we're
Makes
repeating
sense.
things in different environments, And through the repetition, we try to then rewire the brain and then just give them better efficient movement. With a younger child, so the first 3 years of life is extremely important in a child's brain because it's developing so much and there's so much happening with the wiring of the brain that we can really get in there and make a difference. So the younger the child is, the better their physio, the better the quality of their movements later on. But like you say, older children we can still make an impact with, regardless of what therapy they've had before, what experiences they've had before. We can always add to it. One of the big things that we do find with a lot of the medico-legal cases, unfortunately, is that by the time we get to the child and they've gone through the whole legal process, they are at an older age, and so we can't make as big an impact as we could should we have had them when they were within that 1 to 3 year age gap, So it does make it more tricky, but we have seen some amazing results even with our older kids. So yeah, there's always possibility for improvements.
And in terms of the having a team and being at a facility like Funda, how did you find the process? How did you find the arrangements, and how did it impact your therapy style, working with a team of people?
So I found you can't explain the benefits really, because there's so much input from everybody within the sector, whether it's from the attorneys that are fully on board to try and give the child all the funding that they can possibly, to the case managers who we can pick up the phone and say, we've got a problem with this, or what is happening with the case in terms of this. The therapists that we worked with, the speech therapy, occupational therapy, to get together within the session and work on one sort of common goal within our spheres, and being able to then after the session discuss what has happened, what we think could have been better, how we're going to move forwards going from that is invaluable. The other big thing, and one of the major players within the whole team of the child, is obviously the caregiver or the parent, and that also plays such a big role, and we've had such positive feedback from the caregivers and the parents and the grannies who have taken this on so well, done all the exercises asked of us, and we've just seen how the child, even if they're older, even if they're more severely affected, they have done really, really well because we've had the buy-in from the family as well.
Yeah, because that's obviously important. You guys only have a specific amount of time that you can spend with the patient, and they obviously have them every day.
Definitely, yeah. So the family becomes such a crucial part of the team, because it is, we see in them maybe once 1 hour a week, maybe 2 hours.
So you mentioned the family or the caregivers, and obviously having them involved makes a big impact. And because you guys have very limited time to spend with the claimant, and they obviously have much more.
Definitely. So they become such an integral part of the team, and for the therapy to ideally work, we see them for maybe 1 hour, if we see them once a week, maybe 2 hours if we're fortunate enough to see them twice a week. 2 hours out of a whole week is not a lot of time. I often say to my patients, you come to physio for an hour a week, it's like going to the gym for an hour a week and expecting to have a six-pack by the end of it.
Yes.
We really need to continue with all the therapy that has been done at home, and finding ways for the family to integrate it into their busy lives and make it something that is sustainable for them, and it's not somewhere where they have to find an extra hour a day to actually do therapy. We find ways to implement it within the home program and within their daily routines, so that they are able to carry it out. And even if it's a little bit here, 5 minutes here, 5 minutes there, it all adds up and becomes a lot longer that we've actually done therapy for them throughout the week. The other thing is then obviously the 24-hour management of the child and the positioning, and that becomes crucial, especially for their bodies as they get older. The more severely affected child, it becomes a huge factor in how we positioning them throughout those 24 hours, so that we can make sure that they're not picking up spinal scoliosis, they're not getting these hip dislocations, they're not forming contractures, and we try and avoid them as much as possible by correct positioning.
And then part of that also is having adaptive or equipment, basically, that assistive equipment.
Yes.
So, and that's obviously like the pep tube, the back brace, having a proper wheelchair. And I'm assuming you also part of that portion of it, and giving the advice on what to use.
Definitely. So between all the therapies, we all sort of come together and decide on what the child needs, and often we have to decide what's the most important at the time due to funding. The equipment, the pieces are costly. So we often have to come together and decide what are the priorities at the time. And then we work closely with equipment suppliers. If we need splints made with the orthotists, braces made also through the orthotists. So we work, again, the expanding team of getting the equipment suppliers in, getting the orthotists, and then being able to monitor and manage those pieces of equipment, that as the child grows or as there's some other development that might occur within their posture, that we are able to then call them back, or we're able to make adjustments ourselves to be able to maintain and again get that correct position for whatever reason they might have come out of the correct position from before.
Just lastly, in comparison to your own private practice and then working with the team of people, have there been things that you found a lot easier in the process, like especially dealing with the parents? It's not just you and the parent, it's now a team of people and the parent. Did you find that communication a lot easier compared to private practice?
So I have a bit of a niche practice in that I work quite a lot with the medico-legal cases in a school-based setting. There is definitely a lot more involvement that I found from the carers and the families that I've worked with here. But there are some incredible families that I work with within my own private practice that do all the exercises asked of them and everything. So I think that here it's a bit more of a supportive environment in terms of definitely having the backing of the lawyers and being able to have meetings with the lawyers to discuss where we're going and what our plan is with each child. And I think just being on the Funda premises just helps as well, because then you have the ability to, after a session, go and chat to whoever you need to that might not have been within the therapy setting at the time.
Yes.
Whereas within my own private practice, I often need to, after the sessions, then write emails and make calls to the case managers and all the various other people that I may need to chat to. So it does make it a bit easier from a convenience point of view, definitely.
Okay, perfect. Just as a final thought, is there anything that you'd like to highlight maybe to parents of CP kids or parents of neurologically stunted children?
So I think it's such a journey for parents, and I think that it's important for them to know that they are doing everything that they can for their child, and that the therapy is there to help and to assist them, and it should never feel like it's just another thing that they have to do. We really want to be there with the family and be there throughout the course of their journey and really be a supportive role to them, so that they can pick up a phone whenever they need to and ask us for assistance, ask us for our advice, that we really all become part of the team and part of the family of the child. I think it's important that parents know that it wasn't anything that they did to cause this for their child.
Yes.
And it's just a different journey that their child is on, and that their kids are incredible. Every CP child is amazing and can teach us so much about life as well. And I think that we really just want to be there as a supportive role, but they should never underestimate their own value in knowing their kid. I always say that they are the professionals of their child. They're the experts of their children.
Yes.
We might be the medical experts or medical professionals that know a lot about a condition, but they know the best about their child.
Yes.
And to always know that their voice should also be heard within the whole setting.
Perfect. Thank you so much, Kerry. And thank you for joining us today. We really appreciate it.
Okay.
And folks, there you have it. Please keep following this journey with the CP rehabilitation, and please like, subscribe, and share this video, and so that we can get more information out there to the folks that need it. Thank you.